Hey there, and welcome to Making the Most of It, a conversational podcast aiming to educate, enlighten, and empower through intimate and timely conversations with industry-leading health professionals, entrepreneurs, moms, dads, athletes, and beyond. I'm Jennifer Morgan, pediatric occupational therapist and host of this fun, new digital adventure. I'm so excited you're joining the conversation. We've got lots to discuss in this precious window of time, so let's get started. This is Making the Most of It. Today, we're sitting down with Dr. Pejman Katiraei of Wholistic Kids and Families. We learn the history behind his model of ultra-preventive pediatric care and discuss his studies in both traditional and alternative medicine. Dr. K uses his understanding of the brain and the body from a cellular level to highlight early indicators of developmental delay. And he weighs in about supplements for children. Join us on this educational and enlightening conversation. Hi, Dr. K.
Hi, how are you?
Great, how are you? Happy New Year.
I'm good. Happy New Year. Happy New Year to you.
First of all, thank you so much for, taking the time today to talk to me. And I think that the conversation we're going to have is an important one about, just the work that you do and your philosophy on holistic medicine and your practice is really remarkable and unique, I think, in that you're a pediatrician, but you also have the background in these specific specialties, which, and you can kind of explain your story, and just your background, so I don't get anything incorrect here. But I think that you offer something really special, and I would love to ask you to just kind of explain your background and what sets you apart as a pediatrician and the practice for,
Sure.
holistic kids. So
Sure. Okay. So, I started off as just a medical student. It happened to be in osteopathic medical school. And I think that was the first seed of, hey, there's something different in how we can approach patients than just allopathic medicine. And osteopathic medicine does teach us how to use medications and run labs. And in that sense, it is very much a regular medical training, but then there's also this like, hey, the bones and the muscles and all of the things within the body can also affect us. And you should probably pay attention to that as well. So that became kind of the first seed that had me thinking like, that's an interesting way to look at it. And it was actually in my residency at Loma Linda University that I started really scratching my head. We would have these cases, and it's a big institution, and Loma Linda covers, I think, like 100 square miles. So it's a huge amount of territory. So we were getting, the disasters that where like the kid was just falling apart, and heavens forbid they were in the ICU almost dying. And in these cases, I would just come across these scenarios where I would just kind of scratch my head, like, wait a second, that just doesn't make sense. Like 2 + 2 doesn't equal 4. And I'll give you like a perfect example. I remember this vividly. There was this beautiful 15-year-old, super strong, healthy kid who was playing soccer and then got a little scratch in his knee. And then literally like 8 hours later, his knee just blew up. And then 12 hours later, he was dying. And that infection that somehow got through his skin, into his knee, into the rest of his body happened, like that. And, I stood there, I was just like, wait, how many people get scratches on their knees and don't die? Like, what happened to this kid that caused him to die? And then, there were other things, like there was another guy, he was probably about 12 or 13 years old, that came into our gastroenterology unit at the time. And he had colitis, so his bowels were inflamed. And the docs did, the regular course of treatments, and he wasn't getting better. So he came into the hospital once. We gave him IV steroids. He got better. He left. And then like a week later, he was back. And I was sitting there. I was the junior, resident, so I didn't have that much say. I was kind of the data reporter more than anything else. But I remember this vividly where, they went through the conversation. All the doctors had gathered together because he was one of the, worst cases. And they're like, well, this didn't work. This didn't work. This didn't work. This didn't work. So we just need to cut out his colon. Literally. That was their
Wow.
entire logic. And I was just like, wait a second. You're telling me that just because the medications didn't work, there's no other option. So the best option is to cut out this 12-year-old's colon and just leave him basically with chronic diarrhea for the rest of his life. Like
Wow.
that's the option.
Right.
And it was all of these scenarios that had me really stop and say, like, there has to be something more to this. Like you can't just tell me this is all there is. And that was after, multiple experiences like that I kind of said, okay, well, I've got to step out. And I was very blessed to have a mentor at Loma Linda, our program director, Dr. Reason, that said, hey, like, if you're curious about this stuff, why don't you go check out some of this alternative medicine stuff?
Right.
And I went and took one course, and I was just like,
Oh my goodness.
it's like
right. The light bulb went off, and you're like, okay.
yeah.
Yeah.
And
Wow.
over time, so that was 2006, yeah, I look at these days, I'm like, God, I've gotten old, But
When you say it out loud, you're like, wait a minute, that was how many years ago? Right? Yeah.
But, over time, what I realized is everyone thinks that their medicine is the best medicine. And this is something that's really, really fascinating, because if you go to, for instance, osteopaths or chiropractors, all they want to do is treat everything usually through their kind of manipulative medicine skills. If you go see a functional medicine doctor, it's like, let me fix the gut, or you go see someone that treats autism. It's like, let's tweak the metabolic issues and, detox. And one of the things
even
I realized,
occupational therapists, not to interrupt, but like even OT, we kind of, everyone has their own little, niche that they're really good at, and they kind of see through a specific lens. But anyway, I'll let you keep going. But I want to chat about that, because I actually see it in I do things in a little bit different way as well. So anyway, I see that, and refer out, and if there's, other things that are going on with the child, things like that. So anyway.
Thank you for doing what you do. We need to clone you. We need more of you. But I think it's interesting. Yeah, same thing with the occupational therapist. Like, I've learned a lot from all of these incredible occupational therapists that I've come across. But one of the things I realized is, like, everyone has their little piece, right? They have this little nugget of knowledge, and they only see the world through that nugget of knowledge. And sometimes that nugget of knowledge is perfect and it works awesome. But then if you apply that nugget of knowledge to the wrong kid, it completely fails. And I'll give you like a perfect example. There's this sweet little girl that we were taking care of, and she's been a patient of mine since she was little, and horrible digestive issues, weak body, all kinds of sensory things, weird aggression, weird reaction, like throwing and breaking stuff kind of issues. And we did everything. Like, she was seeing OT, I was doing all my regular metabolic cocktails, elimination diet, supplements, blah, 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 blah. Nothing was getting better. And finally, after a year of searching, we did this urine test, and she had elevated oxalates. And it turns out that oxalates just muck everything up. Everything. Cause physical weakness, irritate the brain, exacerbate sensory issues, cause gut issues, et cetera, et cetera. And once we got rid of the oxalates, it was like something magically clicked. But the whole point of this is, if you can't apply the same formula to every kid and expect a good outcome.
Right.
And basically what I've learned to do is see how everyone else sees things. So how do OTs see the world? How do the chiropractors and osteopaths see the world? How do the functional medicine people? And like literally just gather lenses. And it's basically like me putting lenses in front of each other to say, okay, how do I get this picture to come out as clear as possible? And through that is basically how I try to practice medicine, and not be attached to this is how I do things, but it's really what does the kid need? And how can I get that kid as quickly and efficiently better as possible?
Wonderful. I mean, that's my philosophy as well, just efficient, great progress. And I really appreciate what you're doing and the work that you're doing, because I think not a lot of pediatricians and doctors in general will take the time and the energy to, or even take, know to get the training to understand things on a deeper level, and to be able to offer those types of services to their patients. So I think that's fantastic. So I did. I've I've been following your, videos and information, and you have such great information to share. And the biggest the biggest topic I think that I really felt that I connected with, where I was like, oh my gosh, this is speaking to me, was when you were talking about sensory processing disorders and children with ADHD, who obviously those are the kids that, as an occupational therapist, are my primary, clientele. Uh, you know, there are the symptoms and the manifestations of what we see is not just, a child who's clumsy, or they're trying to be bad, or they're just, too hyper and they can't focus. It's actually something that's going on at a cellular level. And I think talking about muscle tone, that was the biggest. When I always like to explain to parents, because they say, why does my child, why are they so clumsy? Why do they have low muscle tone? And I say, it's part of how they're, this is how they were born. But, and then they're like, can you change it? And I said, well, it's really cyclical, because kids who have low muscle tone tend to avoid the exact activities that, and they're not good at them, those activities that will help them to build strength and endurance and improve their muscle tone. So it's just this cyclical thing that happens, and it's hard. But I would love for you to chat about that, and just give your take on, what are the main underlying reasons that you found in your practice and your work, and doing the research on, these kids, and what is going on internally in terms of on a cellular level, and then also in the brain. If you could talk a little bit about
Yeah,
that, that'd be great.
absolutely.
Yeah.
Absolutely. So, life sometimes lines things up in a really interesting way for us.
Mm-hmm.
So, I mean, for years, I've been working with kids who have autism, and it's not my
Mm-hmm.
main practice, but it's something that I know how to do at least fairly well. And one of the things in autism that's really highly stressed is mitochondrial efficiency and optimal mitochondrial functioning and
Mm-hmm.
optimal metabolic functioning. And that's a world that the autism folks know really well. And, I kind of had that in the back of my brain. And then my daughter, who's now 4, was born. And this little girl had super low tone. Like, I remember from the early on when I was holding her, I'm like, oh, this tone is really low,
Mm-hmm.
And fast forward at 11 months of age, she still wasn't crawling. This poor thing was actually kind of slithering, like she was kind of pulling herself on the floor just because her core tone was so low. And we were doing regional center and working with OT and PT and doing all of this stuff. And if you saw the shenanigans that were happening in our home to try to get this girl to crawl, we're like people would laugh. Literally, they'd be laugh. They're like, dude, you're a little crazy, But because I know the consequences of her not crawling and how all of that impacts integration, like I was just like, little girl, you gotta crawl, So I was getting a little crazy, but it dawned on me that all of a sudden it's like, wait a second, what causes low tone? From early on, so
Mm-hmm.
forget about, and I think your point of, because these kids don't trust to use their bodies, they don't use their bodies, and that impacts tone, which is absolutely true. But what initially caused the tone to be low? And that's the mitochondria. So when you look at muscle, so muscle is dependent on energy, right?
Mm-hmm.
It needs ATP to basically contract,
Right.
actually relax. But muscle movement is dependent on energy production. And ATP is basically our body's currency of electricity, right? It's the equivalent of electricity. And when the lights are dim, when energy production is low, and kind of what you talked about with genetics, I'd say about 10% of the population genetically is
Mm-hmm.
inefficient in producing energy. And we call these people normal, and they are, but it's not optimal. So they're kind of on the slower side of energy production. And I happen to be one of them. My daughter for sure is one of them. And I'd say 50% of the kids that I see with sensory issues are part of that camp, perhaps even more. So at a genetic level, if energy production is not optimal, then you get muscle weakness pretty much everywhere, right? So the core is weak, so these kids don't roll easily because it's so much harder. And like the flip side of it is my son, like this guy, I mean, he might as well, like, he's 1 years old. I mean, he looks like he's shooting up steroids. It's like crazy, like
Isn't it
deltoids,
fascinating?
like
They're
he's just
literally
strong.
just they're just made differently, you know? It's just so interesting.
Yeah. Yeah, it's the
Yeah.
coolest thing. It's the coolest thing. But like, I mean, this guy, like at one, not only is he just, I mean, he crawled by I think
Mhm.
7 months. But now he's running. He's literally 12 and a half months. He's
Wow.
trying to run. And this kid is like climbing stuff and he's just strong. But that's the
Right.
difference. And these are the things that we take for granted. So with my daughter, because her core was weak, she couldn't
Mhm.
really roll over easily. She couldn't engage her core to get into the,
Mhm.
quadruped arm feet position or arm leg position. And it was astronomically harder. Now here's the crazy thing. So finally, after harassing my wife, I think for a month, finally she's like, okay, fine, give our daughter the
Mhm.
supplements. And she was the youngest person that I had ever
Wow.
supplemented because I was treating mostly older kids. So I gave you some carnitine and CoQ10, and the weirdest thing happened. Within a week, this little girl that was slithering on the floor got into a perfect quadruped position, so perfect arms, legs, and then started
Wow.
crawling. And then a week after that, she got up, and then a week after that, she was walking. And it was a very interesting pattern where then my wife would be like, okay, enough, stop. I would stop. And then literally this girl that was walking with a fairly stable gait all of a sudden would become wobbly and would
Wow.
start falling. And it was
Ooh.
because her tone had gotten weak again. And when you
Wow.
look at what ultimately stimulates mitochondrial biogenesis, so the mitochondria
Mhm.
replicate, right? Exercise, in aerobic exercise, aerobic activity actually stimulates the mitochondria to replicate. So the weaker you are, the less you move, the lower your mitochondrial
Mhm.
numbers and counts go, which ultimately causes you to feel weaker. So it's that vicious cycle you talked
Mhm.
about, right? So not only is it muscle bulk, and not only is it that we don't, because we don't move, we don't build
Mhm.
the muscle itself at a cellular level, kind of what you talked about, the mitochondria themselves within the cell actually drop in count. So each cell at a cellular level is producing less energy. And you either end up with the picture of my son, who's just this wrecking ball of a human being, moving all the time, strong, full of energy to the point where all of us get exhausted just being around him. And then there's my daughter, who we have to supplement and get her to
Yeah.
move and really stimulate her body to actually produce energy in a more efficient way. Otherwise, she drops
Wow.
down.
I mean, it's really remarkable. And so when you explain this, it helps me to understand what's going on when parents ask me, because it's a question that I get asked all the time. And, what can I do? How can we improve tone? And it's definitely a topic that's been discussed in occupational therapy, world for a long time. And I feel like all of this makes so much sense to me, and now I feel like I'm actually going to be able to tell parents and help. And so it's like it just seems like a very good additional the supplementing is a great way to uh, obviously do these things that you said, like, build actual the muscle fibers, and to like really, create efficient energy in the body so that kids can, you know meet these milestones and maybe participate in occupational therapy, and improve their goals in a more efficient way.
Yeah.
So that's
Yeah.
really, really wonderful. So uh, what do you have a way to like test the children? How do you know, are there specific supplements that you kind of use, what, when you see a child, what, based on what their diet is, how do you kind of go about, do you do a test, or how do you figure out what to do?
So, a great question. And, there are tests out there. So, they're through a few different companies, Great Plains, Genova Diagnostics, some of these private labs, you can actually do this test called the urine
Mm-hmm.
organic acid. And most functional medicine doctors can run those, and that gives us some ballpark idea of how much of an issue there is. There's this test called the mito swab where you actually do a swab within the cheeks, and that actually checks to see the actual mitochondrial function itself, which the urine test doesn't
Mm-hmm.
do as well. Uh, honestly, over time, one of the things that I have found is no test is perfect. And there are times that for other reasons I'll do these tests because I can also see, if there's fungal issues, bacterial issues, if there are these oxalates, other compounds that I'm worried about. If it's just a question of, does the kid have a metabolic issue? If their production of energy is inefficient, sometimes what I'll suggest to parents is just take a supplement. There's some really cool supplements out there. One of the ones that I happen to like, and I have no affiliation with this company at all, is Neuroneeds. And it's just this really cool combination of B vitamins and carnitine and CoQ10 and all this stuff that the body needs to produce energy. But one of the things I suggest to families is just go buy some kind of supplement that increases energy, and it happens to be a hell of a lot cheaper than doing the test. So these supplements sell for 50 to 80 bucks, and that's typically 1 to 2 months of treatment versus doing a $200 or $300 or $400 test. It's like, do this. And the thing that's really cool is if the child needs the supplements in a very noticeable way, sometimes a shocking way, all of a sudden the child's energy is substantially better. The kid that wasn't jumping is jumping. The kid that wasn't running is now running. Some of the kids are riding bicycles for the first time. Like it's to the point where the parents are like, "Wait a second, is that my kid?"
You.
Like it's not.
That's really really cool. And how long does it usually take? You said about a week for your daughter. I think you saw for it to really take effect in the body.
If it's a pure metabolic issue and these kids have just a simple error, within 1 to 2 weeks, parents should know, like, oh, yeah, this is really doing something for my kid. And a lot of the times, part of what I love about kind of having the team approach is, a lot of the kids, when they're working with occupational therapists, and this may be your experience sometimes, like, because they're weak, everything takes so much longer, or they hate coming to OT because it's just so much work for them. And then when you bump up their energy, now that they actually have the energy here, right? Because the brain is also sensitive, and they physically feel more capable, all of a sudden they actually have fun doing occupational therapy. And the therapists are like, whoa, this is so much better. Like, everything happens kind of like what you talked about, more fluidly and more efficiently.
Well, I would hope that OTs make OT fun. I'm just kidding. I'm like, wait a minute, that's the whole point. We're supposed to make it like enjoyable. The kids aren't even supposed to know that they're working on stuff. But no, I mean that's how we practice. But no, that's I can see that, and I think I think this is great. I feel like this is groundbreaking. Is that an okay term to use? I feel like I haven't heard of people doing this, and I know that your whole, I think it's Wholistic Minds, is you guys are starting to offer consultations internationally. Are you one of a few doing this? Are other pediatricians starting to do this? Do you know?
So I think there's definitely a lot of people that have been doing this. They just happen to be in the other world, right? So the autism folks have been doing this for over a decade. I think the problem is that the connections haven't been made. Those that treat the sensory kids haven't yet put together the fact that these kids probably have a metabolic disorder.
Yeah.
So part of my purpose and why I'm doing all of this is I look at all of the suffering, all of these kids that are struggling, and it's like, God, we got to do something about this. And that's why I'm so grateful to be here and to, for us to kind of co-share this message. But no, these connections haven't happened. And I guess it's groundbreaking, but for me, I'm just sharing information, and I just happen to be good at putting some pieces together. That's the way I look at it.
I think I wish that I had known more about this sooner, to be honest with you, because I feel like I'm so glad I know it now, and I'm going to share this information with as many families and clients and potential kids as possible. But I do. There's such I can see how what you're saying. The integration of the people who are working with the kids on a daily basis on these skills, combined with proper underlying physical, neurological, improvements in the way that their body and their system is working. I mean, those in combination it's really, I'm excited about that. And I think, a lot of times with the students that, and the clients that we work with, a lot of them have attention difficulties. And I recommend that kids, that parents look into medication for their children, if it's impacting them. But I feel like this is such a great first step before that step, especially in LA, and especially because so many parents are, not wanting to put their child on a medication at a young age. So, do you also recommend
Well,
medication sometimes?
I mean, I think medications
Mm-hmm.
are a tool, right? And sometimes different tools
Mm-hmm.
are necessary. And at the end of the day, our goal should be to help the kid, really flourish and be happy and stable and really functioning well in their life. And if, inattention is something that's disabling them, then sure, a medication is useful to
I
change
agree.
that.
I agree.
I really wish the entire world knew of people like
Oh,
you,
thank you.
because
Me too.
no, you're welcome. You're welcome. But here's the thing. So medications work for
Mm-hmm.
how long? If we're lucky, 6 hours, maybe 12 hours, and
Oh
then they come with their own
gosh.
host
Right.
of issues, right? Low appetite, insomnia, and I've got kids where they're being managed by someone else. But like, I have one kid. He's 12. He's on
Mm-hmm.
4 different medications. He's on four
Depression,
different medications,
anxiety,
and
attention. Right.
yeah, yeah. And the part that really breaks my heart, and why each day I become a little bit more uh, driven to do what I do, is what happens to the kids that they have the sensory issues, they have the sensory problems, they don't work with someone like you, they're put on medications for whatever period of time, but then they grow up and then they decide to stop taking
Right.
the
They
medications.
don't have
Guess
any
what?
tools.
All their issues
Mm-hmm.
come back. And one of the things, I don't know if you had seen this in the scientific literature, they talk about how kids with ADHD have such an astronomically higher rate of school dropping out, high school, college, if they
Mm-hmm.
make it to college. Uh, their risk of being incarcerated is 2 to 3 times that of the regular population. And for me, it's like, well, yes, all of this stuff, all of the occupational therapy, all of the sensory integration, changing the diet, changing the supplements, all of this is
Mm-hmm.
work. But this is a child's
Right.
entire
Yeah.
future. And, for me, part of what really, I guess, breaks my heart is really the best way to put it. What breaks my heart is to think about, like, how many kids do we set up for a path of failure because they come to think of themselves as dumb. They come to think of themselves as this unruly kid that just can't sit still, and they can't, right?
Right.
Sensory integrations don't go
No.
away. Like, if you're the kid that has a bad sensory integration issue, you
Right.
become the adult who is exactly
Right.
the
It's the
same.
low self esteem. I mean, that's when I really start to. You see the kids who they literally can't help it, and then they start to really they become hyper aware of that and start to get really down on themselves, and they literally can't
Yeah.
help it. So yeah,
Yeah.
that's why I do what I do, and I'm excited that you you know are offering so much information. Just I actually want to, or I want to chat. We need to chat again because I feel like I want to. There's a lot of other things I want to talk about. But for today, I think I'm just grateful for your time, and I want to.
Sure.
I guess I want to wrap it up. Unfortunately, with just one one more question or comment, I guess, which is,
Yeah.
uh, what piece of advice would you give parents or educators or anyone listening? Just a general piece of advice in terms of just what you've, in your experience, what you've worked on, and just your own life experience. What's one thing that you would kind of let people know?
Don't be afraid to ask questions, and don't stop looking for answers.
That's great.
I think a lot of parents feel defeated because when they go to whomever person they're working with, whether it's the pediatrician or what
Mm-hmm.
other doctor they're working with, and they're told, well, no, this is just what is. Your kid is just the way they are. don't stop looking for answers. Keep asking questions. Be the pain in the butt to everyone's rear end, because you know what? It's your kid's future, and you deserve to expect that they can have a happy, healthy, and successful future. And it's okay to bother people to make that happen. So don't let people dissuade you from saying like, hey, something is weird. My kid is not healthy. Don't be afraid to say that, and don't be afraid to ask the questions, because when you ask the questions, the answers will ultimately come. Sometimes it takes a year, but they will
I
come.
agree with you. That's wonderful advice. So thank you. Thank you so much, Dr. K, for your
My
time
pleasure.
and energy and all of the work that you're doing. And yeah, I'm so grateful. All right, you guys, that's the end of our show. Thank you so much for joining us this week. Let's always remember to stay humble, be kind, and to take the opportunities we have to help educate, enlighten, and empower ourselves and those around us. We've only got this one life. Let's live it well, or try by making the most of it. Take care till next time.